Good afternoon, everyone. Welcome to the Rocky Mountain College White Coat Ceremony for the Occupational Therapy Doctorate Program. I am Corwin Southern. I'm the Program Director for the Occupational Therapy Program. We'd like to give a special welcome to our students, to our guests, to our faculty, and everyone else who might be here supporting our students. We'd like to recognize faculty on the front row and also our guests that we have. We have Dr. Hiram Harrelson, you can kind of wave if you want, and Dr. Randy Hansen, and Dr. Paula Kitzenberg. And we have two guests from Leaf Pediatrics, Brittany Riker, and Casey Callahan. Welcome. We also have several other people who do a lot for our program and help events like this to run smoothly. So we'd like to thank Linda Eliason for putting all the details of this ceremony together. And thank you to Caleb Smith for taking pictures and managing our website and the live stream today. So just what is the significance of the white coat ceremony? In the early 1990s, several medical and therapy programs realized waiting until graduation to perform the ritual ceremonies of professionhood was a regrettable disservice to students. It was reasoned that students actually enter the professional life when they begin their fieldwork experiences. At the core of human health and healing are complex issues of professionalism, humanism, and ethics, issues that should be explicitly addressed when students start all of their fieldworks, not just when they finish it. And thus, the white coat ceremony was born. During the last 2 decades, the white coat ceremony has grown to become the feature event for almost all medical programs and countless other health professions, including occupational therapy. Students, By choosing to be part of Rocky Mountain College, you have joined Rocky's occupational therapy's tradition of service, dedication, and leadership. So thank you. You've come this far in the program, and I say congratulations to you this far. Okay, we'll turn the time over to Dr. Hiram Haraldson, who is our academic fieldwork coordinator, to present our Partnership in Fieldwork Education Award.
All right, I am very pleased to present our Partnership in Fieldwork Education Award. This is a special award. It goes to a fieldwork site that has been dedicated in partnering with us to take fieldwork students. And I want to note that all of our fieldwork sites are volunteers, and so they volunteer to take you all as students. So treat them with the respect that they deserve. But this year, we're pleased to announce this award for LEAF Pediatrics. LEAF is an incredible clinic. It was founded in 2017. I don't want to mess up your last name, Brittany, but by Brittany Riker, right here on our front row. Our therapists our students love coming to LEAF. They love the therapists, the education that they receive there, and they love what an amazing clinic LEAF is, that they get to see both equine therapy, aquatic therapy, standard outpatient therapy, sensory integration, everything at LEAF. And so we want to present this award to you. Thank you so much for your partnership with us.
Okay, congratulations, and thank you for being here. Our faculty speaker today is Dr. Randy Hansen. She has been an OT for over 28 years, with highlights of serving in the U.S. Army in Fairbanks, Alaska, working with the residents of the high Mojave Desert in California. She is certified in low vision rehab and as a mental health first aid provider. She has earned the following awards: Arctic Medics Safety Award, Hero Transition Award, U.S. Army Commanders Award, and the Mary J. Bridle First Research Award by the American Occupational Therapy Foundation Phi Theta Epsilon Honor Society. She volunteers currently at Eagle Mountain Billings and YWCA Women's Shelter here in Billings. She enjoys hiking, camping, hunting, going to concerts, and spending time with her daughter, Torin. Dr. Hansen.
Thank you all. Thank you for all of you that are here today too. I want you to look around the room for a moment. Take a good look at the people sitting next to you, behind you, in front of you. These are the people who stayed up with you the night before an exam, who pushed you through anatomy and physiology and neurology, who challenged your thinking in class and kept your spirits up when the coursework felt impossible. These are your people. And in a few weeks, you're going to leave this room and this campus and these people, and you're going to walk into a clinic or a school or a hospital or community center for the first time as a clinical OT student. And everything is going to feel very, very different. I want to talk to you today about what that difference means and why it matters more than you think. Let me start with the thing most of you are quietly thinking, but perhaps you're too anxious to say out loud. Am I really ready for this? The honest answer is yes and no. And that's exactly where you should be. You've spent the last semesters building a foundation. You understand the occupation-based framework that defines our profession. You know the models, MOHO, PEO, PEOP, cognitive disabilities, CAWA, and burning. You've practiced clinical assessments and therapeutic use of self. You've learned to write goals in language that's measurable and meaningful. You've read the research. You've done work. But here's what no classroom can fully prepare you for. The weight of a human being sitting across from you who's frightened or grieving or exhausted and looking to you for help. Fieldwork is where you learn to carry that weight. Not perfectly, not without stumbling, but you learn, and the stumbling is a part of learning. So if your heart's racing a little right now, good. That means you understand the stakes. That means you're paying attention. Nervousness is not a sign that you don't belong here. It's a sign that you care. And caring is the most essential qualification for this profession. In your academic training, you learn about occupational therapy. In fieldwork, you learn how to be an occupational therapist. The distinction sounds simple. It's not. Being an occupational therapist means holding the whole person in your mind at all times. Not just the diagnosis on their chart, not just the goal on their treatment plan, but the person who was a carpenter before their stroke. The mother who can't wait to braid her child's hair again. The teenager who just wants to be able to sit in the classroom without pain. Occupation is not a clinical abstraction. It's someone's life. And your job, our job, is to help people reclaim access to their own lives. You will walk into fieldwork knowing this intellectually. Over the next several weeks, you're going to begin to know it in your gut, instinctually. And that is a profound transformation. Let me be honest with you about some things. Some things that are coming, you're going to feel like you don't know enough. You're going to ask a question or encounter a condition or be asked to do something and feel completely unprepared. This is normal and universal. Every occupational therapist who has ever practiced, including those of us that taught you and those of us that are going to be supervising you, has felt imposter syndrome at least once. Your job is not to know everything, but how to find out who to ask and how to stay humble while you're learning. You will have a day, probably more than one, when something doesn't go well. A session falls flat. A patient is openly frustrated. You say something imperfect. You freeze when you wanted to be confident. These moments are not evidence of failure. They are the material from which clinical competence is built. Write about them in your reflection journal. Bring them to your supervisor. Sit with them. These will make you a better clinician. Give yourself the grace to make mistakes because this is how you learn. You will also have moments that take your breath away. A patient who hasn't used her hand in months picks up a utensil and feeds herself for the first time. A child who's been in therapy for years makes eye contact with you and says your name. The gentleman who's going home after a long hospitalization tells you quietly that he didn't think he'd ever get back to his garden, and now he thinks he can. These are the moments that will carry you through dark periods and hard days. Hold on to them. Remember, these are the reasons that you chose to be an occupational therapist. Your clinical supervisors are one of the greatest resources you have. They've chosen to take on the role of educator and mentor in addition to clinician, which is no small thing. They are giving you your time and expertise deliberately as a volunteer. Be curious with them. Ask why not just how. Ask them about their hardest cases. Ask them what they wish they'd known when they were where you are now. Ask them what they're still figuring out, because the best clinicians never stop learning. At the same time, know this: your supervisor's way is not the only way. You might observe an approach and think, I might do that differently. That's a valid thought. Hold on to it respectfully and bring it to your academic advisor or your supervisor as a question rather than a critique. The ability to hold our own with developing clinical judgment while remaining open to learning from those with more experience, that is a genuine skill, and field work is where you practice and perfect it. I want to say something directly about professionalism because it encompasses more than just showing up on time and dressing appropriately, though I urge you to please do both those things. Professionalism in field work means being present. It means putting your phone away and giving your full attention to the patient sitting in front of you. It means maintaining confidentiality so carefully that you don't talk about cases in the hallways or the elevators. It means communicating clearly and promptly with your supervisors, especially if and when something goes wrong or you are uncertain. It also means advocating for yourself. If you're struggling, say so. If something feels ethically wrong, speak up and tell someone. If you are overwhelmed, reach out to your academic field coordinator or your advisor. You have a support system. Your program built this exactly for this reason. Using that is not a weakness, it's strength and wisdom. And professionalism means respecting the full humanity of every patient you encounter. Their diagnoses do not define them. Their disabilities do not diminish them. You will work with people and families who survive things you can't imagine, who carry strengths that they aren't even aware of yet. Your job is to see those strengths clearly and to help patients build on them. Here is something I'd like you to give yourself: permission to be a student. It might sound obvious, but I mean it sincerely. You don't have to perform with confidence that you don't yet have. You don't have to pretend to know things you don't know. You're in a learning role, and there is a profound dignity in that. The patients you work with will often know that you're a student. Many of them won't mind at all. In fact, some of them will treasure the extra attention you give them, the extra time you take to explain things, the genuine curiosity you bring to their care. And some of them, in ways that will move you, will become interested in your learning too. Being a student means asking questions without embarrassment. It means reflecting honestly, even when reflection is uncomfortable. It means updating your thinking with new evidence or experiencing challenges that you never believed you would before. This is actually what good occupational therapists do for their entire careers. Fieldwork is just where it begins. Before I close, I'd like to remind you of something. You chose this profession. Out of every career you could have pursued, you chose one that exists specifically to help people live fuller, more meaningful lives. Let that sink in for a moment. Occupational therapy was founded on a radical idea that engagement in meaningful activity is central to health and human flourishing. That what we do with our hands, our bodies, our hearts, our minds, our time, our communities, shapes who we are. And that when illness or injury or disability threatens engagement, we can help restore it. You are the inheritors of that idea. You're going to carry it into hospitals and homes, schools and communities. You're going to meet people on some of the hardest days of their lives and help them find a path forward. That is not a small thing. You are also going to make mistakes and learn from them. You're going to be unsure and grow more certain. You're going to have your hearts opened in ways that will surprise you. And you are going to come back from your field work placements more capable, more grounded, and more convinced than ever that you chose the correct path. When you walk into your placement site on your first day, you're probably going to be nervous. Here's what I want you to do. Take a deep breath, stand up straight, and remember that you belong here. You've earned the right to be in that room. You've put in the work, you have the preparation, the passion, and the people standing behind you, your faculty, your classmates, your supervisors, your family and friends, all cheering for you, all wanting you to succeed. I want to leave you with some of the most applicable quotes I could find to help guide your future clinical practice. Robert F. Kennedy said, "Some men see things and say, 'Why?' I see things that have never been and say, 'Why not?'" The Robert Rush said, "I know that my goal is more than a thought. I'll be there when I teach what I've been taught." And my final quote from one of my personal heroes, the late Neil Elwood Peart, late drummer of Rush, started every single day saying, "What is the most excellent thing I can do today?" Go out there and meet your patients. Listen to them. Learn from them. Teach each other things that a textbook never could. Use your patients' goals as a means to make dreams come true. And know that when you come back, we will want to hear every story. This is where it begins. The best of luck to all of you, and go do something meaningful and most excellent. Thank you.
Thank you, Dr. Hanson. Our student speaker. Our student speaker is Madeline Husband from Roanoke, Indiana. Before OT school, she spent several years as a preschool aide, as a paraprofessional for behavioral skills in the classroom setting. She graduated from Indiana University, and I have a little note here to say, "Go Hoosiers." She has a degree in psychology with a minor in exercise science. As a future therapist, she is highly interested in pediatrics and mental health. Maddie.
Hello, and thank you guys for joining us for the cohort 2029's White Coat Ceremony. If I could take a moment to be selfish and sorry, I don't know, your face just scared me a little bit. He's telling that. I could take a moment to be selfish. I'd like to thank God for bringing me to you people. I'd like to thank my parents who had also never stepped foot in the state of Montana before I told them they would have to move me here in the dead of winter. I would like to thank our professors. We see all the hard work you guys do and we're so grateful for it. And of course, I would like to thank my wonderful cohorts. Over the past few months and countless hours, I've gotten to spend getting to know you guys. There's no greater group of people I would rather spend countless hours getting to know. You guys are creative and supportive and all extremely intelligent in one way or another. When I first moved here, I started attending church nearby my house, and one of the first sermons I heard that really stuck with me was about the purpose of life. Well, more specifically, what the purpose of life isn't. And over the past few months and countless hours that we spent together, you guys have really reinforced the things that They said, the purpose of life is not self-preservation. So self-preservation to me means safety. It means never changing, never adapting, living inside of a bubble, never doing anything to make yourself uncomfortable. Now, there's really been two main ways that you guys have proven this to be true. The first being the fact that you're even here. Did you guys know that grad school was going to be hard before you signed up? Did you know that getting your doctorate is no walk in the park? On top of that, it's pretty expensive. So if your goal was to be comfortable, those probably wouldn't have been my first steps. But you also have families and spouses that have had to change roles or change their schedules to help support. You've had to take out loans, move across the country, find a new job, or more likely spend months trying to find a new job. But the fact that you're here, you're willing to try, you're willing to be uncomfortable, tells me that you're not necessarily here for your own preservation. The next way is the fact that occupational therapy exists at all. We spend months and countless hours brainstorming ways to help people keep the function in their daily living. We focus on rehabilitation and habilitation, learning and relearning ways to maintain independence and do the things that you love with the people you love for as long as you can. I've seen you guys take 2-sentence case studies and breathe life into them, finding ways to defy a diagnosis and go above expectations of what that person might do. Finding ways to instill meaningful practice and help people not just live, but truly be alive. And over the past few months and countless hours, I have been so blessed to watch you all develop your practice. I can confidently say that I am so excited to get to enter this field of occupational therapy at the same time as the rest of you. Through your expertise, your compassion, your empathy, and ability to put yourself in someone else's shoes is going to make you all fantastic healthcare professionals. Now, speaking of becoming healthcare professionals, I think it's about time that I wrap up my speech. But I'd like to once again thank you all for being the greatest cohort a girl could ever ask for, and the rest of you for the support that you give and continue to give. Thank you all, and go Hoosiers.
All right, thank you, Maddie. It's now time for coding and pinning. So Dr. Harrelson and Dr. Hanson, come forward, please. And students, I'll have you please rise and then line up over here. Okay, first, Emily Cole. Reagan Fellows. Anna Guttormson. Madeline Husband. Samantha Martin. Lisa Miller. Elizabeth O'Brien. Ella Peters. Parker Smith. Taylor Thompson. And Jennifer Woods. Okay, very good. Class of 2029, this coat which you now wear represents a commitment to the values and ideals of our profession, your ethical obligations to each patient and client to whom you encounter, and to your pursuit of lifelong learning. The occupational therapy oath, which we'll recite in just a minute here, highlights a commitment to the profession's core values and principles. Your pledge today emphasizes compassion, client-centered care, confidentiality, lifelong learning, advocating for clients, is grounded in the profession's ethical guidelines and the core values of altruism, equality, justice, and dignity. All students, please rise. Please raise your right hand and repeat the oath of an occupational therapist after me. From the privilege and rights this code confers, I hereby pledge my knowledge and skills to the good of those whom I serve. Therefore, I will endeavor to keep both the profession and occupational needs of the clients and communities I serve foremost in my thoughts and actions. Deliver occupational therapy services that demonstrate the pursuit of excellence, celebrate individual differences, and respect all people equally. Advocate for the services and rights of clients regardless of constraints I may face. Strive to act in a manner consistent with the philosophical base and values of the profession by upholding the Occupational Therapy Code of Ethics, abiding with those who need care, accepting the potential of personal risk, advancing the dignity of all people, model and foster leadership, and facilitate personal and professional growth. In myself, in my profession, and in others. In keeping with the unifying values of Rocky Mountain College, I swear to be receptive to what those around me can teach. Be committed to scholarship and the pursuit of truth. And be dedicated to building a community of justice, respect, and the common good. All right, you may be seated. You all look so good. And I would say very professional with those white coats on. You know, professionalism is something to describe can be a little lengthy. Kind of like if somebody asks you what occupational therapy is. However, professionalism is something that you know it when you see it. It's treating everyone with ethical dignity. It's taking the high road when maybe you have been offended. It's about always doing the right thing, even when nobody is watching you. It's carrying yourself with humility that emulates confidence while never placing yourself above others, but a desire to lift and serve those around you regardless of who they are. Students, you have been challenged and worked hard in this program. However, you have all responded with resilience, which has built character and hopefully prepared you to be leaders and always fighting for that which is right. Congratulations to you and all those who support you and continue to support you. Work hard to gain the tools necessary to become an outstanding practitioner. We look forward to your great accomplishments ahead of you. Well done. Thank you again for everyone in attendance. I know some of you came from a long ways away to be here, but thank you for supporting your family, your students, and watching them as they continue. They're about coming up on the third semester, wrapping up the summer. So congratulations to you this far. And this concludes our white coat ceremony. Thank you. Students, follow Caleb out to the door this way. Get your picture. Family, you can follow too.
Actually, probably the thing I miss, as weird as the sound I miss about both the most is the really nice piano in the cafeteria. I could play it for lunch break. So, I don't need to.
I have a
I haven't ever played that one. I usually play on the practice piano in most camps, but they're not as much. Yeah. That sounds.
I don't like the audience.
It's probably because I was in twins, so attention is too much for I always joke that I go to attention.
So you're off the hook. You can have to say.
Is there anything else we need to do because there's a massive thunderstorm? We hit in about 5 to 10 minutes. Just, do you make that better? Just so you know, I had to take my own.
Meeting you.
It's okay. I just looked up and was like, oh, God, okay. Oh, yeah, just bring it in. But yeah, we don't want to hang around. It literally does not look nice.
Thank you again.
Yeah,
It's so nice to meet you.
You're so
Nice to meet you.
Costume and put it
Nice to meet you. Nice to meet you.
Have a good one.
You too.
A little cloudy now.
I know, no, it's
Keep the
coming in.
rain
It's
away. No, I have a
literally
wedding from
running.
5 to 7 outside. So
They have a, do they have a plan?
they probably do. I'm not in charge. I'm not in charge. So that's.
Okay. Yeah, this looks like he's probably.
It's nice to meet you.
Oh no. There it is. It's still here. Ooh, that sky looks bad.
to watch it.